passionate advocate for integrating technology into healthcare to promote innovation and health equity. He graduated in 2021 from the College of Integrative Medicine and Health Sciences in mind-body medicine. Oh, actually specialized in healthcare systems, focusing on health information platforms. His dissertation explored collaborative methods for developing patient-centered digital platforms in dentistry, and he received for his dissertation the Dissertation with Distinction honor. I will leave the rest of his introduction to him because it wraps around his content, the content of his presentation today. So take it away, Robert.
Sure, thank you for that introduction. And it's good to see Dr. Luann Fortune here. She was along for the ride in this lengthy process. So I wanted to go through a shorter version of what my whole dissertation was about, not least the process of it, because I anticipate that there could be more questions because it's kind of a complex set of circumstances that we were trying to weave into the whole process. So very quickly, the background, I came from epidemiology, and I had this deep passion for approaching healthcare on a population level. I studied other country models, and when I got back to the United States, there was a bit of this reverse culture shock, specifically around healthcare, and specifically centering on how we've sort of lost our connection via community and or the individual that kind of gets lost in the numbers, as it were. And so I had a passion for looking at how can I approach large population health and focus on integrating the individual and putting the patient back at the center of the actual healthcare system. So I happened to have a buddy who he had just finished his dentistry degree and was working as a young dentist. And so we were trying to cross-pollinate our recent education and passions. And we determined that dentistry was sort of this one of the forgotten arms of healthcare, that everybody is a dental patient, whether they go or not. But it's kind of swept under the rug, or it's sort of like, you get a call from your dentist like, oh yeah, I got that tooth cleaning coming up again. So we wanted to see if we could make it more approachable to the average person, because from my personal experience, I had come to understand that I was very out of touch with my own oral healthcare. And to be sure, that was just an indicator of all of my healthcare. And so we started this venture of how do we reach the most individuals in the most personal way. And so we decided to do it in a digital platform. This was in 2010 to 2012, approximately, that we started looking at what is the best way to approach this. And back then, smartphones were sort of just becoming the mainstream. So we determined that this kind of technology, we projected that it would be with us for a while and that it was getting good traction across the board. Why not apply that in a healthcare level? So all that led to eventually then me finding Saybrook, or Saybrook finding me, right? And I came in with this deep, fiery passion, having already started on that journey. The reason why I started at Saybrook was because it looked like there was a good parallel in what my values were and what the university was actually able to sort of walk me through that whole formal process along the way without losing some of those core elements, in particular integration. So my dissertation was called How to Create Academically Relevant Digital Dental Health Information Platforms, which is a mouthful, through end-user collaboration. It was a theory-driven participatory action research case study. So that's a whole lot, but I'll go through and I'll break down each of those elements so you can see what it is and why we actually approached it that way. Let's see if I can progress the slide here. Sorry about that. So the problem that we were facing, and this was well known when I came in to be a dissertation student, the dental industry, it's no secret that they're wildly behind the rest of healthcare, not least because they're sort of an island unto themselves. And so anything that is happening within dentistry, you have to go to each specific location, and you have to get through this barrier of each dentist has the way that he runs his office or the way that she runs her office. And it's probably been that way for a while. Not much has changed in the industry. And so we saw that there was a real disconnect, not just from patients to their dentist, but also from dentists to the rest of healthcare, specifically including in the technological end of things. So we were coming up against basically a disconnect from what patients had access to and what they were able to engage in for their own healthcare. So the vast majority of non-collaborative digital dental health ventures fail to progress beyond the pilot stage of development because they typically lack measures of accountability to key end user needs and industry stakeholder preferences. This was brought in as a key consideration of if we're going to be successful in an industry that is already so independent, how do we do it in a very mindful way that gives it its best chance of hopefully flourishing? Sorry, I have a bit of a lag. So after much deliberation, I think that myself and the individuals involved, we went through exactly how to try to squeeze this all down into a single research endeavor. But the question became finally, how can a tethered digital dental health information prototype created based on academic evidence and a collaborative end user-based process? So that really means, in a nutshell, we wanted to look at how can we actually, if you guys are familiar with EHRs and PHRs in the hospital system, a physician has access to health information and then extends access through what they call a patient portal. So the patient has access to part of their health information. And then they can use that software through their respective portals to go back and forth. So all we're saying by tethered digital dental health information prototype, we wanted to create what is already a model within a successful model within the medical field, but we wanted to do it for dentistry in particular. We knew that it was a huge undertaking, so we determined it was probably best to only do a prototype version. Let's get a proof of concept going and see if we can hammer out some of the details that are going to be most relevant or critical for the industry and for patients and dentists alike. So with that, we wanted to make sure that it was academically rigorous. What does the literature say? And then how can we actually involve those people that would be key end users and or stakeholders within the industry? What is it that we need to be looking at from all the different perspectives? And then we, as you'll see later, we landed on that there's going to be 4 key roles: the dentist, the patient, the software engineer, which is very important in this because it's a software platform. It has to actually be viable in reality. And then also we determined that we needed a group facilitator because it was multi-layered and very complex, and we were trying to do a lot in a very short amount of time. So the purpose was to produce this tethered EDHR PHR platform prototype, just the software itself that represents the dentist portal and the patient portal. And it was going to be tailored, a bespoke product for the dental healthcare industry. We wanted to incorporate the end user preferences. Key end users in this case was the dentist and the patient. And then eventually down the road, we got to other industry stakeholder considerations. But we wanted to base it on research as well as the direct contributions of these individuals who would then be using it, the patient and the dentist. And that was a little bit tricky just because in dentistry, nothing had been done like this before. And so I was having to draw from a lot of medical information, what's happened in healthcare in general, and how do patients just at large, how have they interfaced with technology, and what does that mean for how we actually apply it back in an academically rigorous way? So we decided to do a triangular assessment of construct elements that were emphasized within the literature. We wanted the participant groups' needs and preferences to be shown in the whole process, which was the dentist and the patient. What do they each respectively need? And how is that represented in the software? And then the particular design features and functions within the platform, we nicknamed it Bowser. Just in one of our many long conversations, we said we can call it whatever we want. We just nicknamed it Bowser because it was sort of this budding, developing thing, and we didn't know how it was going to turn out. But we put this fun, memorable, proper noun to it, right? So the reason why I was doing this was it was very clear from the get-go. There were many reasons, and really it was, how do I squeeze that down into one single dissertation that makes sense and tracks linearly with what I'll actually be able to accomplish within the parameters of doing a dissertation with proper academic research. So what we were looking at was to improve efficiency and efficacy in the dental treatment and preventive services. Dentistry is broken down into two key elements. There's the treatment, and then there's essentially you're doing all the preventive services, which is like cleaning, this kind of thing. But we wanted to get at both ends of those if possible. We wanted to improve patient engagement and specifically control over their own personal health information. A lot of patients don't know that they own their information outright and that they can go ask that. But at the time that we started this, and mostly still today, if you want to actually go get a comprehensive health history from your dentist, good luck. You might get a printout on literal paper, or they might actually try to burn a CD or a DVD for you. And it's just very old school, and it's not effective. And so most patients, they don't even know this, but even if they try, they're thwarted, and it's not actually something that's functional or practical. So we also wanted to see the aggregated and coordinated local and national oral health population data, so that we could actually be tracking this on a population level that was something scalable to in the entire North American population, not just say like one specific dental office. Like, so what applies universally here? Yeah, the literature, it was very interesting to try to bring this all together, because I had both a wealth of information that was relevant to medicine, but then a scant bit that was actually able to translate exactly to dentistry, specifically the way that we were trying to approach it. And so I landed on what could I actually get enough literature on where we could track something and translate it. And that was the adoption incentives, the adoption barriers, and that's to the technology itself, the patient preferences, the provider preferences, as well as their needs, and then the total team collaboration. So the methodology consisted of the single case study design. Because it was contemporary, it was an unusual phenomenon. In this case, it didn't exist yet. And then we wanted to be applying this in a real context. And so partway through my PhD, actually, I had the privilege of buying a dental office with my business partner, who himself was a dentist, and I started running it just to be extremely thorough and understand all of the ins and outs of what is it that a dentist experiences and what is it that the patients experience. So in the middle of that process, I was trying to do my PhD. I was also trying to, for the first time, run a dental office. And so it was a very rewarding experience, but it was very intense throughout the whole process. We wanted to obviously ensure there was in-depth empirical and qualitative elements that braided in nicely. And that's also how we landed on the single case study design. Everything just kind of fit. And that's Robert K. Yin, I believe. So the approach was also a little bit unusual. The participatory action research, we wanted to engage the end users, and they themselves were part of the process of what was the final outcome and what were the findings. So we were indeed trying to actually build, it was a prototype, but we were actually trying to construct the software while we were coming up with what are all the most important elements that need to go into the software. So it wasn't just a passive list of what is it that we would like, what's our grand fantasy wish list of everything that you could have. It was, what is everything that you could have that you want and or need that we can actually integrate into this process. So that's how we ended up on the participatory action research design. And then the theoretical framework was based on Davis's from MIT in the 1980s, had coined this term, the technology acceptance model, which was a great basis to look at how is it that end users, as well as the co-creators, the software engineers, how does that process culminate in something, a software that's actually functional and usable by the end users, in particular when there's multiple end user groups. In this case, it would be a dentist they've got their own priorities, and then the patients who have a whole different set of priorities. I do have to note that the scope, because we were going for something that was so large, I was always being coached to make sure that I was bringing it down to a scale that was approachable. So we limited to just general dentistry within the United States in particular, which there's approximately 170,000 general dentists, but they are distinct from other specialty dentists. We were aiming to land on a prototype of a tethered EDR PHR, which is that there is a dentist portal, a login or sign in and a view for the dentist, and then a patient portal with their login and sign in and view. And then we had a very small participant team because it was so much engagement over our 7-week sprint when we did our final research data collection. It produced over 350 pages of this verbal information that was all relevant data, but that had to be approached and it had to be brought in and sort of corralled into something meaningful, something that I could actually extract back into how does this actually apply and where can we actually align this with the real world principles as well as maintain that academic rigor. And then we had a limited time and financial resources. Effectively, we were asking these participants to do a whole lot of heavy lifting within each their own expertise. So we brought in a practicing general dentist who was also a parent at the time. And so, you know, life is going on, but we were forced to rely on all of the expertise of a dentist, of course, to see that perspective. And then there was a patient who had all of their considerations and everything was happening in real time. And then we needed a legitimate software engineer who had actually worked on projects and had brought software to fruition so that we could know that we had reliable expertise. And all of this, we were asking everybody to do this essentially for free on their own time, right? On their own dime, on their own time. So it was a very large undertaking, but we found some angels in the community. I reached out to dental offices of the area. Fortunately, I was fairly well networked, and we had one dental office that kind of picked up on the concept, loved the idea, was happy to be a part of research team. And then from there, we went out and sent out to all of the patients, we'd like to invite you to this research. And then we whittle it down to who is the most viable individual who's able to meet all of these things that we're looking for in this sort of very intense undertaking in this 7-week sprint. So the participants, as we were talking, the end users, there was the key patient, the key dentist, and then we broke it down into the prototype development side of the team, which was the software engineer and the group facilitator. And again, I just happened to luck out on this group facilitator individual was a champion, because my model was I staged everything very rigorously with academia. I had this endless list, it seemed, of academic questions, and I wanted to address every specific point that came up in the literature. I mean, hundreds of pages of literature, had to condense that down into meaningful talking points. And the group facilitator somehow managed to keep everybody on track while they were trying to design and build the software, as well as get through all the academia and bring in all the perspectives in a meaningful way. So I was very fortunate to have that experience. My role as I was going through it, once everything was, the stage was set, all I did then was basically queue up the meeting and then hands off and watch their process. It was all formally organized, and there was a whole roster of meeting 1 through meeting 10, and this is what we are hoping to do and what we expect could happen or should happen. But it was really up to them after that, and so I was sort of at the mercy of how does this team actually function or operate together, and what rich things are we going to discover along the way, and it was a lot. So I did do a phase, what we're calling phase 1. This is the pre-dissertation, where we said, this is a lot. It's very complex. How are we going to approach this and make sure that we're able to check all the boxes without missing some of those key elements that we're going for? If what we need to produce in the end is very complex, and there's certainly no guarantee that we're going to be able to get there just because of the volume and the complexity of everything involved. So we decided to do phase 1, and it actually turned out surprisingly well. And so we decided we'll continue in that same model for phase 2. And what that yielded was an EDR PHR prototype with the whole user interface, user experience flowchart. And it was this grand, beautiful thing that they created. And then there was an entire video that walked through the UI UX flowchart, which is essentially the map of what it looks like. They call it in software the wireframe. It's the map of what does every single minute element in the software actually do, how does it function, and how does it relate to every other single part in the software. And then we had the EDR PHR prototype screens of, this is a mock, but it lays over the functional part, and you can actually see what this software would look like. And indeed, the team went above and beyond, and they actually made it an interactable prototype so that you could actually look at this. Although it was just a prototype, it wasn't launched, it wasn't carrying live patient information or anything. You could actually navigate all the way through the entire software. It was actually very impressive. And so the outcome was what we were calling Bowser, this EDR PHR live app prototype. So the live element is that you could engage it. You can go to a website and you could click through everything and see how it functions and sort of intuitively get an understanding of what are all the elements that the dentist needs and is looking for, and then how does that relate on the patient portal side of everything. And then there was a grand walkthrough where they spent the final research data collection was them just going through this platform that they had created. It was actually quite amazing. And then the software prototype, what we ended up bringing it down into of how do we act, what are we calling this prototype? What is it? How's it classified in the software world? It was a mobile cloud database hosted tethered EDR PHR SaaS ecosystem. So it was this grand big software, not this, at the beginning of the whole process. Some of my friends were asking me like, oh yeah, how's your little app going? And by the time we were done, the SaaS ecosystem platform, it was this wildly complex, very blown out, very detailed entity that was, it was hard to translate it and bring it all back down into when I was doing the dissertation defense of like, what all is this software about? Can you tell me about this? Like, well, do you have 2 or 3 hours? But in reality, the key components that we're looking at was we had a patient portal that had all of its own features and functions of things like how do you schedule and how do I know what my last procedure was and the procedure that is upcoming, what steps do I need to take? Is there like a pre-medication or any of that? How do I change something? I need to manage my children's dental health. Where's that interface so I can track my children's health and all this kind of stuff. And then the dentist side, which fortunately the dental industry was not lacking in a dentist specific facing software set of platforms. They already had a paradigm that existed as far as a dentist portal. So everything that the dentists already needed, most of it was there. And so we kind of built off of that. And then we added all the things that were not there, in particular, those elements of, well, once you add a patient portal, then it opens up all of these opportunities of everything else that you can actually do and what the dentist is then able to actually accomplish within the software. It was this whole new exploration. So we started with that kind of industry standard model of what is basically a practice management software look like in a dental office. And what happens then if you bring in the whole other side of now patients can start to engage the software in a meaningful way, and what would that look like? And then obviously the bidirectional interactions between the 2 portals is they need to be able to use this. It's not just a noun, it's a verb. Things are happening all the time. And there are one-to-one elements or one-to-many and many-to-many. And that was really fun trying to map all of that. Of the themes, so I took all of the output of the research data collection. It was all qualitative, so spoken information was 350 pages or so. And I spent many months going through and saying, okay, how do I bring this back down into the literature that maybe applies, that then people can pick up this research and continue from there? And what does that all look like? So from the patient portal, there were 5 themes in total and 5 categories. It gets kind of complex, which I can talk more about that later. But the patient portal, they were looking for empowerment. The dentist portal, they wanted to be enabling both their staff members and their patients. The patient-dentist interaction, they were looking for unity. They wanted to be able to actually work as a team together. In the platform system, they were looking to innovate on everything that already existed. They wanted to take it to the next level. And then the health information technology and the American Dental Association standards, they approached those with a whole notion of reconceptualizing this sort of, I would say, old school paradigm. They wanted to bring it into contemporary technological standards as well as healthcare integration standards. So the prioritized features and functions, the patient really what they landed on, when they go into their portal, what is it that they're looking at? They really wanted to be able to use text messaging, treatment planning, insurance and finances, and appointment management. And appointment management as a key note was mothers in particular wanted to be able to access their children's portals specifically. So parents wanted to be able to engage the appointment management for their children. And the dentist, He wanted it to be mobile. And from mobile, he wanted to be able to do triage reporting. So when a dentist over the weekend gets a call, he wants to get more information. He wanted to be able to text directly through the software any of his patients. And then he wanted e-prescription services so that he could also do that sort of on the go or from home or the golf course or wherever they might be, right? And then the in-office, all features and functions seen within Bowser, that's what they prioritized. He was like, yeah, within the office, it's everything. I can't whittle it down to like one or two things. It's everything. So the demonstrable needs within dentistry, what we were aiming to do, and I think what we partially at least accomplished in a theoretical stance, to meet technological standards involving meaningful storage and use and access to patient health information via this portal that both patients and dentists can connect through. And then obviously in the real world, trying to translate that, there are massive challenges that I still am carrying along with me, not least bureaucratic. There's obviously some technological and then the human-centric considerations. Not everybody is on the same wavelength of everything should be integrated and everybody's, should be treated equally and all this kind of stuff. There's a lot of the mindset still of like, well, patients don't know what they're talking about. And so, like, why would we give them access or power to do this and that? It's like, we would always come back to, well, right, that without the patients, there wouldn't be any healthcare providers, right? So getting through that, some of the, I would say, old school mentality, that was a known challenge going into it, but then trying to apply that into the real world since then, those themes have come up again and again. And then the implications of what does this all mean? Well, the prioritization was to take dentistry toward healthcare integration because they're sort of this forgotten child left in the corner. We think of like, oh, there's medicine and then there's dentistry. Well, is that not all part of the same body? And if for an individual, your health and your wellness, every different element or aspect of your body is very important. Let's bring those all together so that, and our goal was to put the patient at the center and have all of their providers sort of orbiting around them versus right now what the kind of North American standard in healthcare is. You have all these different providers, and then as the patient, you're expected to go find an orbit and when you can get in and see that one, and then there's a separate one over here, and sometimes they're conflicting, and it's right. It's very challenging for patients. And so what we're aiming for is let's bring the patient back to the center. Let's remember actually what healthcare and what wellness is actually all about. Yeah, and then obviously the levels or the tiers that we're looking at, the implications. There's national oral health, of course, and now we've been exploring some of the global health oral health considerations. Healthcare integration at large for all of the different disciplines within healthcare and wellness. And then public health, because we were going through this right in the middle of COVID, there were all of these amazing, I guess you could say opportunities, but also some striking concerns of, and how what a reality check it was for the world to see when it all actually hits the fan, as it were, on a global level, right? How prepared are we, and what is it that we actually, what systems do we have in place? And so from my point of view, as both an epidemiologist and then now in the software end of things, I was like, all I see is rich opportunity, which means there was a lot of work. And North America in particular, I still believe has a lot of work to catch up on several factors that we could actually be there already. We just haven't prioritized it and or we're not aware of these things. And then obviously the continuing research, and that was fundamentally baked into the design of the outcome Bowser that we're calling it, this EDR PHR platform. Yes, it's this fun little tool that you can go check your appointments and this kind of thing, but actually underneath the hood, we're looking at integrating big data where we actually take all, if you have say 10,000 dentists who are using this and there's 2,000 patients per, that's 20 million people worth of big data that you can then actually start to perform some meaningful research on an epidemiological level, a true population level. And so that was one of the key elements that was baked in from the beginning. And then my conclusion was, with appropriately established industry allies and stakeholder partnerships, I believe the design, development, and implementation of a nationally scalable tethered EDR PHR platform would not only be possible, but should be viewed as both probable and advantageous to the practice of dentistry and national oral healthcare at large. I'd like to open it up for any questions.